Hi there, and welcome back to my channel Ultrasound Explained. Don't forget to subscribe to stay up to date with my latest videos, as I'll be posting these weekly. In this video, I'll be discussing a really quite common question. How many ultrasounds can you expect to have during your pregnancy, and when will these scans typically occur? Let's dive right in. In a pregnancy that's progressing as expected, the standard schedule typically includes 2 to 4 ultrasounds. This would always include a first trimester ultrasound, typically a dating scan, and another in the second trimester as a thorough anatomy or morphological ultrasound. However, this can vary based on individual circumstances, and some doctors will request additional scans, typically between the 12 and 16 week mark, which will coincide with first trimester screening, as well as another scan in the third trimester, normally beyond 28 to 30 weeks, to monitor fetal growth and well-being. Factors such as the timing of your first visit to your healthcare provider, any unusual symptoms like bleeding or pain, and any discrepancies or complications related to previous pregnancies can influence the frequency of ultrasounds that you may have. During the first trimester, typically between 6 and 12 weeks, ultrasounds will play a crucial role in confirming the pregnancy and assessing the early fetal development. The primary purpose of the first trimester ultrasound is to confirm the presence of a live pregnancy in the correct location within the uterus, ensuring that it's developing correctly. This will also help to exclude an ectopic pregnancy. This scan also helps to estimate gestational age and the due date by measuring the crown to rump length, which is the measurement of the embryo from the head to the bum. The scan also at this time will check for the presence of twins, triplets, or any other multiples of pregnancy. This is important for visualizing this as early as possible, as the correct classification of twins is going to be crucial. So for an example, are there 2 babies sharing the same gestational sac, or are there 2 separate gestational sacs? This in turn will allow us to plan for the correct management throughout the pregnancy, as twin pregnancies will usually require more frequent or more specialized follow-up ultrasounds throughout the journey. Although detailed images of babies' limbs and other organs are not visible during this early stage, the first trimester ultrasound can help us check for other structures that will be expected as part of baby's normal growth. These structures will include things such as the yolk sac, which will provide the nutrients to baby before the placenta forms. This will appear on the ultrasound as a small little hollow circular structure within the pregnancy sac. Another thing we may expect to see is the amniotic membrane. This will grow as baby grows, and it contains the amniotic fluid that baby will be suspended within. Another thing we may expect to see at the late 7 to early 8 weeks are what we call the limb buds. These are little swellings, what will give rise to the arms and legs later in the pregnancy. Around 12 to 16 weeks, you may undergo an additional ultrasound, which is often combined with prenatal screening tests. During this scan, there is a focus on performing what we call the nuchal translucency screening. This test is specifically performed between weeks 11 and late 13 weeks. And the aim of this is to assess for the risk of chromosomal abnormalities, particularly Down syndrome. The sonographer will measure a translucent area at the back of baby's neck using ultrasound imaging. Now, while a certain amount of fluid is normal, an increased thickness of this translucency can be an indicator of high risk of chromosomal abnormalities. We will combine the measurement that we get from this scan with what we get from a maternal blood test, where we'll measure your beta-HCG or your pregnancy hormones, as well as a protein called the pregnancy-associated plasma protein. This is going to be produced specifically by the placenta. There are also more modern screening methods, such as the first trimester combined screening. In Australia, you may have heard this been called the Harmony test, or sequential screening. These blood tests will measure specific proteins and hormones in your maternal blood. We combine this with factors such as your maternal age, as well as other conditions, to further evaluate the risk of chromosomal abnormalities and other genetic conditions. It's important to know that both of these methods, though, are just a screening tool, and therefore they don't provide a definitive diagnosis, but instead will identify pregnancies at higher risk. This will then prompt further testing if necessary. Now, this further testing is going to be slightly more invasive via an amniocentesis, or what we call a chorionic villus sampling, and this will involve taking a physical sample from around the developing baby. Nowadays, when performing the first trimester screening, doctors typically like to combine this with an ultrasound between 12 and 16 weeks, as this will provide an opportunity to perform early anatomy checks. While this may not be as comprehensive as the second trimester anatomy scan, the sonographer will begin to examine your baby's major organs and structures. They may look for visible signs of abnormalities or markers that may warrant closer monitoring or additional testing in subsequent scans. This could include things such as a low-lying placenta, or similarly maybe following up a subchorionic hemorrhage, which we'd seen a bit earlier in the first trimester. Overall though, the 12 to 16 week ultrasound and prenatal screening offer a really valuable insight into your baby's well-being and will allow for the early detection of any potential issues. As we enter now the second trimester, typically between 18 and 22 weeks, also known as the anatomy scan, we will now gain a more detailed insight into fetal development. This scan is really a significant milestone as it will offer a comprehensive assessment of baby's growth and anatomy. During the second trimester ultrasound, the sonographer will meticulously examine different aspects of fetal growth. They will assess baby's head, brain, spine, head, stomach, kidneys, limbs, and also the genitals. This detailed evaluation will help detect any structural abnormalities as well as any congenital abnormalities. It's also the most reliable time to assess fetal gender. Additionally, the sonographer will check the amniotic fluid levels around baby. These are crucial because it's essential cushioning for baby and will protect the fetus during development. We'll also assess the placental position and ensure that it's not covering the cervix, as this could lead to further complications when you're due to deliver the pregnancy. Lastly, the second trimester ultrasound may identify specific markers associated with chromosomal abnormalities, such as Down syndrome, as well as any congenital heart defects, any neural tube defects, as well as potentially a cleft palate. Now, while some of these soft markers might not necessarily indicate a specific problem, they could require further diagnostic testing or closer monitoring throughout the pregnancy. Overall though, this second trimester anatomy scan will provide expectant parents with a really detailed glimpse into their baby's development and offer both reassurance as well as valuable information for prenatal care and planning. Now, as we approach the third trimester, typically beyond 28 weeks of gestation, the ultrasound examinations will become less routine, but do remain essential in specific circumstances. And while some countries do not perform these ultrasounds routinely during this stage, they may be recommended based on individual needs or concerns. During the third trimester, ultrasounds will focus on assessing fetal growth, as well as baby's positioning and general well-being. These scans particularly are valuable in monitoring pregnancies which are deemed to be high risk due to maternal health factors, any previous pregnancy complications, or any concerns in this particular pregnancy around fetal growth restriction. One of the primary objectives of the third trimester ultrasound is to assess fetal growth and ensure that the baby is developing adequately, assessing for any signs of growth restriction. Similarly, as I said, determining fetal position is going to be really important, as this will be crucial for planning the mode of delivery. The scan will identify whether the baby is head down or what we call in the cephalic position. This is going to be optimal for a vaginal delivery. Alternatively, baby could be in the breech or what we call the transverse position, but this may necessitate other additional interventions such as a cesarean section. We also in this scan are going to reassess the placental position as well as the placental function. This is particularly important in cases where there might be concerns around any placental abnormalities or if there's any insufficient blood flow reaching the baby. These scans will allow the healthcare providers to monitor any previously detected fetal anomalies or structural abnormalities through the remainder of the pregnancy. While third trimester ultrasounds are not routine for all pregnancies, they do provide valuable insights for informed decision making and appropriate management of any pregnancy-related complications. It's important to remember that the number of ultrasounds can vary based on individual health conditions as the pregnancy progresses. If there are any unusual symptoms or concerns, your healthcare provider might recommend additional scans. Ultrasounds are tailored to individual needs, ensuring that both the mum's and bub's health are closely monitored throughout the pregnancy journey. So in summary, while the 2 to 4 ultrasound scans are typical in a pregnancy journey, the actual number can vary based on individual circumstances. It's crucial to follow your healthcare provider's recommendations to ensure a healthy pregnancy journey. Thank you for watching today's video on pregnancy ultrasounds. If you found this information helpful, please do give it a thumbs up, as well as subscribing to Ultrasound Explained for more insights. Please be sure to leave any questions that you might have in the comments below, and I'll be sure to get to these in future videos. I appreciate your support, and I'll see you all in the next video. Thank you very much. Bye-bye.